So today we are going to discuss about a different topic, that is phobia. So what is phobia? It is nothing but the extreme and irrational fear of something. That is a phobia. Here we are discussing about types of phobias. First is pediophobia. It's a fear of dolls. Next is a philophobia. It's a fear of falling in love to someone who can't love back. Next is acrophobia. It's a fear of height. Next, nyctophobia. It's a fear of darkness. Next, ophidiophobia. It's a fear of snakes. Next is bathyphobia. It's a fear of deep water. Next is procruscophobia. It's a fear of gaining weight. Next, murophobia. It's a fear of rats. Next, inoculophobia. It's a fear of crowd places. Next, cynophobia. It's a fear of dogs. Next is ligerophobia. It's a fear of loud noises. These all are the types. The next is the management. Many people with phobia don't need treatment, and avoiding the object of their fear is enough to control a problem. However, it may not always be possible to avoid certain phobias, such as fear of flying. In this instance, you may decide to get professional help and advice to find out about treatment options. The common treatments used in phobias are counseling, CBT, and medication. Sometimes this counseling is enough to reduce your phobias. Next is CBT. CBT is cognitive behavior therapy. It's a type of counseling that can be help you to manage your problem by changing the way you think and behave. It can be used to develop practical ways of dealing with your phobias. For example, if you have a fear of snakes, your therapist may start by asking you to read about snakes. They may later show you the picture of a snake. They may then arrange for you to visit the reptile house of your local zoo to look at some real snakes. The final step would be for you to hold a snake. So this will help you to reduce your phobia. This technique is more common in phobias. Next is medication. The medications are not usually recommended for treating phobias. However, the recommended treating medications are antidepressant, tranquilizers, and beta blockers.